panel. So my name is Haley K. Scott, and I am the Climate Justice Grassroots Organizer at Beyond Toxics and the NAACP Eugene Springfield chapter, and I will be the moderator today. So I just wanted to provide a brief context in what we're planning to talk about during this webinar and the types of discussions we're hoping to foster. So underrepresented communities, including but not limited to immigrant communities, Latinx communities, people of color, and those on the front lines, are overrepresented in the number of confirmed COVID-19 cases throughout the country and internationally. These communities are also dealing with a myriad of other climate and environmental stressors in their daily lives. This webinar, Unjust Care, Pandemics and Race, will shed light on the racial impacts of COVID-19, noting historical patterns observed during pandemic-like situations, and how communities are shaping a caring response to a public health crisis in place of an efficient government plan. And we were able to invite 4 amazing speakers from different backgrounds and communities who are going to speak to the topic of achieving environmental justice during and after COVID-19 locally and internationally. And it's important to recognize that the panelists today do not represent or highlight the voice of every community and their experiences. It does, however, provide us with a starting point in our efforts to find timely and equitable health and environmental solutions. So a quick run through of the agenda for today. Each speaker is going to present for 10 to 12 minutes. The last 20 to 25 minutes of the webinar will be a moderated Q&A discussion. Attendees will be muted for the entire webinar. So if you have any questions, please put them in the Q&A and we will try and be as responsive as possible. So our 4 panelists today include Pradnya Garud, Dr. David Galvez, Eric Richardson, and Joel Iboa. And we will start with Pradnya. Pradnya is a PhD candidate in the School of Geography, Development, and Environment at the University of Arizona, and holds a courtesy research assistant position in the Department of Sociology at the University of Oregon. She received her Master of Science in Environmental Sciences and completed a postgraduate diploma in disaster preparedness and response. Prior to starting the PhD program, she worked as a research and advocacy associate at a human rights organization in New Delhi, India. She is an environmental justice scholar and currently serves as the co-president of Beyond Toxics. So Pradnya, go ahead and get started.
Thank you. Good morning, everyone. Thank you, Haley, for the introduction. I would like also to thank the Beyond Toxic team and my co-panelists for organizing this thoughtful panel discussion. My talk today aims to give an overview of historical roots of pandemics and discussing its impacts. I have referred interdisciplinary literature, namely evolutionary ecology, sociology, and environmental geography to prepare this talk. This presentation is divided in 3 parts, which are represented in following 3 questions. First, what is the relationship of globalization of economy, food systems, and pandemics? Second, what are the impacts and changes that follow pandemics? What are the organizing efforts that we are witnessing in the present crisis? Would be the last. I begin by trying to unravel the relationship between ecology, economy, and pandemics. For this, I'm drawing from the work of Mike Davis, an urban geographer, author of Asian Flu, and Rob Wallace, an evolutionary biologist well known for his book, Big Farm Makes Big Flu. These authors argue that though the practice of domestication of animals for consumption and agricultural purpose has been practiced since ancient civilization, the industrialization process has significantly altered the way we engage in agricultural and allied activities. Largely in the global south, colonialism has led to resource extraction, change in land use, and natural habitats. This has produced unequal divide between the global north and south. Since the era of neoliberal globalization, which is usually marked by free trade agreements, free flow of capital through expansion of cheap labor markets, deregulation, minimizing role of state institutions and individualization. This has deepened the existing rift between economy and ecology and inequalities between north-south, rural-urban. Advancing on this understanding, Rob Wallace makes stark connection between global capital accumulation, determinants of ecosystem, and human health. In his analysis, he writes that localized food systems, livestock management, and small land holdings are replaced by big private agribusiness interests. As these businesses prioritize maximizing profit making, which results in land grabs, large-scale deforestation, and agricultural intensification that underpins the emergence of epizootic outbreaks in the global south. To give an example, the outbreak of Ebola in West Africa is directly related to deforestation related to corporate-owned palm oil plantations, which displaced indigenous people and small landholders and severely impacted environmental and human health. Similarly, other pandemics like swine flu and Asian flu can be traced back along the same paths. Professor Peter Lee explains the emergence of coronavirus in the wet markets of Wuhan are connected to the large economic and social processes that were taking place in China since late 1970s. He emphasizes that the sale of wildlife in these wet markets are mostly for the consumption of elites who are just minority among the Chinese population. Moving on to our next question related to the following uh, impacts of change that follows pandemics. It goes without saying that pandemics have historically disproportionately impacted the marginalized population. Mike Davis writes, quote, during 1918 Spanish flu pandemic, 60% of mortality, that is 20 million deaths, occurred just in the state of Punjab, Bombay, and other parts of Western India. Synergy between pandemics, poverty, malnutrition, and unequal access to healthcare facilities hit the poor hardest. What does social distancing guideline mean for people living in morbid realities of slums, refugee camps, etc.? So studying how change occurs during crisis, Naomi Klein suggests that the political strategy of shock doctrine is used to push through policies which leads in deepening the inequalities of our society and benefiting the elites. In her words, quote, in moments of crisis, people tend to focus on daily emergencies of surviving that crisis, whatever it is, and tend to put too much trust in those in power. We take our eyes off the ball a little bit in the moment of crisis. This reminds me of example of my hometown Mumbai, where plague of 19th century completely altered the housing situation. The colonial administration then established Bombay Improvement Trust to create healthier cities as they rationalized that laboring classes and their unhygienic conditions were the reason for the spread of plague in Bombay city. This policy systematically benefited the upper caste elites and formation of exclusive gated neighborhoods, displacing and destroying indigenous peoples' agricultural lands and villages. Similar patterns can be seen elsewhere in the world. Addressing the last question of my presentation, that is, what are the organizing efforts that we are witnessing in the present crisis? I strongly believe that in midst of this crisis, which is of this magnitude, we should organize and demand state for providing basic needs and not just rely on philanthropy. We are witnessing incredible courage from the frontline workers who are organizing strikes and demanding protection and pay. Many grassroots community efforts have also taken place in absence of coherent and adequate state response. To give few example, I came across the Sikh community run kitchens which have been feeding people who have lost their livelihoods. These are the examples from Delhi and LA and other parts of US too, where the Sikh communities have these kitchens. The other example is of mutual aid networks that are helping people under economic duress in midst of this pandemic. Just to end and summarize the talk, I would say that going forward as we respond to this crisis and next, our organizing efforts should be connected to the deeper analysis and historical understanding, so that we should seek to link environmental movements with labor activism, healthcare advocacy, racial justice, and other range of movements across the globe. Thank you.
Great. Thank you so much, Pradnya, for opening up this webinar with the historic conditions and implications of colonization on a global scale. Those are all very important factors to consider as we move forward in developing sustainable solutions using that intersectional lens. So next up, we have Dr. Eva Galvez. Eva is a board certified physician at the Virginia Garcia Memorial Health Center. She has over 15 years of experience working in federally qualified community health centers. As a bilingual and bicultural clinician and growing up as a daughter of Mexican immigrants and seasonal farm workers, she brings a deep understanding of the health issues affecting this community. Her particular interests are in the health disparities that affect the Latino community, exploring the root causes and finding ways to address them so that we can strive for a more equitable Oregon. So go ahead and take it away.
Thank you so much. First of all, I want to thank everybody at Beyond Toxic for inviting me to be part of this growing community of voices that is really shining a light on the impact of COVID on vulnerable populations. It's really happy to be here, and I want to thank Pradnya for bringing such a global perspective and a historical perspective to the pandemic that we're seeing. And today what I really would like to do is I would like to sort of focus on a more local level, which is why I appreciate that global perspective. And I'd like to bring it down and shine a light on the community that I currently serve. I want to talk about the disparities that we're seeing and how we've responded to address some of the need that is rising from the pandemic, and then talk about just some of the things that I'm learning and that I would like to see as we move forward so that we can begin to strive for a more equitable community. So like I said, I am a physician, and so my perspective really is frontline. Before the pandemic, my work consists of taking care of patients with chronic illnesses, also providing preventative care, seeing babies, people of all ages and stages in their life. Of course, 2 months ago when COVID-19 began, things really changed me and my clinic, and we started to really begin to shift the way we were doing work in our clinic. We started to shift to telehealth and also to screening and testing our community. Just to give you a little bit of background on the clinic that I work for, we are a federally qualified community health center, and we are located west of Portland. We serve Washington and Yamhill counties, and the population that we serve is diverse. We do serve some people who are living more in urban areas like Beaverton and Hillsborough, but the farther west you go, we definitely have a more rural population. 60% of our patients speak Spanish. 20% are migrant and seasonal farm workers. And so our mission is really to remove barriers for our patients and to provide culturally competent, high quality care to those vulnerable populations. And so back in March when COVID started, I'm really proud of my clinic who was able to anticipate that COVID was going to be really a threat to our community. As most of you know, our community already suffers disproportionately from many chronic illnesses. And so we knew that COVID could have the potential to really exacerbate the health disparities that we were seeing. So in mid-March, when we still had very little guidance from the CDC and Oregon Health Authority, my clinic began to look at how we could provide screening and testing for the community. So we were one of the first health centers in Oregon to provide testing and screening. By March 16th, when testing was still very limited because we had very few tests available to us, we partnered with a private lab and we began to do drive-through testing at our 5 primary care clinics. And a week later, we were able to open up 2 drive-through testing sites as well. At the same time, those of us that were on the ground started to notice that there was a real gap in knowledge within our community regarding what COVID was and how this disease spread. So at the same time as we began testing, we also launched Spanish language PSAs on the radio and on Univision to provide some education to our community regarding COVID and how it spread. So I'm really proud of this initial this organizational response that we had to this pandemic. We began testing, and what we really started to notice, though, about a couple of weeks into testing, this was in early April, that even though we were testing and that the community had knowledge, I was still hearing from patients that they were going to work. And patients were telling me stories about working elbow to elbow on the farm or on the factories. I had stories from patients who were being told to buy their own PPE by their employer. I heard patients telling me that yes, their employers had told them that they needed to follow social distancing, but yet they were not really giving any guidance on how to do that. A lot of the seasonal workers were telling me that they didn't have enough hand washing stations and that they were not being provided with extra hand washing facilities. So all of these things were really on the back of my mind as I started to notice that even though my patients had some knowledge and they had access to testing, they were still really being exposed to the virus. And what we noticed by mid-April is that by mid-April, we had a positive rate of 17%, actually 14%, which was much higher than the average positive rate in Oregon. In Oregon, the positive rate for COVID was about 5%. Our community was at 14%. And not only that, if you broke it down by race, what we were finding was that of the Latinos that were being tested, of those that were being tested, 97% of our positive results were in our Latinx community. And this really was alarming to me, although not entirely surprising. As a physician, what I know is health disparities have always existed. Whether it's diabetes, asthma, hypertension, cancer, we know that health disparities exist. And what this just really proved to me is that COVID-19 is really not any different, and that many of the factors that are driving the disparities for diabetes and hypertension are the same factors that are driving the current disparities we see with COVID-19 right now. So needless to say, with the numbers that we were seeing and with what we were hearing from our patients and what they were experiencing on the ground, we really continued to work hard and began partnering with other organizations. For instance, we partnered with Oregon Food Bank so that we could bring food to our patients, as we were noticing that a lot of our patients were experiencing food insecurity. We also began taking some foods and medications and essential things to some of our patients who were being quarantined. We also supported the Oregon Worker Relief Fund, which I'm sure Joel will talk about a little bit, as we saw that part of that we really needed to be involved in this larger advocacy effort. So think what I would like to highlight and is that COVID has really shined a light on the health inequities that already exist. And I think what we're noticing now is that with the Latinx community, it's particularly difficult for our patients to be safe when they're considered essential workers, but yet they're going to the front lines and doing essential jobs without the protections that they need. I hear of patients who continue to go to work because they know that if they don't go to work, they're not going to get unemployment. They don't have sick leave. They don't qualify for public assistance. And so they're compelled to go to work because there's real fear about losing the job and the financial insecurity that leads to. And so I really, what I would like to highlight is that a physician, I am noticing, or what I am seeing, is that you can have data, you can have testing centers, you can have knowledge about how to mitigate COVID-19, but we really need people on their end who are helping us look at policy and address those systems that are keeping our patients from being healthy in the first place. So I think that our patients need to have living and working conditions that really can support these healthy behaviors that doctors are promoting. So I'm going to leave it at that, and I am happy to take more questions later on and talk a little bit more about some of the work that we will be doing in the migrant camps this summer in order to start testing this high-risk population.
Awesome. Thank you so much, Eva. That was a really great presentation. I really appreciate you mentioning how these disparities have, they exist. And the current pandemic has served as a way of uncovering, like the blinds, like, okay, this is actually a problem. And the information that is there to address the problem, but we need to make sure that it's accessible to everyone, that access to healthcare is a human right. Access to a healthy working, conditions is very important in sustaining these solutions. So next up, we have Eric Richardson. Eric is the Executive Director of the National Association for the Advancement of Colored People, Eugene, Springfield, Oregon unit. And before he was appointed as executive director, he served as the president of the chapter for 4 years, and he is a very prominent leader here in the community. So Eric, go ahead and take it away. Eric, you're on mute.
Okay, can you hear me now? All right. All right. Well, it's good to be here with you today. I am here representing the NAACP, and when we look at the long history of the NAACP's relationship with the federal government, this is in direct relationship to this question that we're looking at today. The NAACP has a history of asking the federal government to look at its soul, to look at the creed in which it claimed to have been founded, and to try to correct its actions in accordance with that creed. And so this has been a 111-year-old project of the NAACP. We are not satisfied with the relationship as it now stands. We feel like what we are seeing right now in response to the coronavirus is a lack of leadership at the federal level in a way that is costing lives. And so this has a long history going back just as our previous had talked about. This has a global history and a significant history that needs to be addressed in this time. We need to understand that this is the time to have analysis of where we've been, what we're going through now, and how we can move forward. I think looking at the pathway to the present, as we call this, is the pathway forum and summit. There are two pathways I like to talk about: is that how we got here, the pathway, and then pathways to leadership going forward. The historic pathway to the present is based on one that is traditionally put finances and the market-based interest above the interest of human life. This is something that as an African American, we know too well. And we have been asking for a remedy of this. And through time, over the last century or so, we've seen starts and fits of these policies being put into place and then being walked back, 2 steps forward, 1 step back. But we need to be persistent in our demands of our government to look forward. And so I am asking that going forward, that we understand that no matter what, we have to be very wary of this year's elections. We need to get out the vote, and we need to vote in every manner we can. And it's very unfortunate that we have a lot to think about right now, but let's not take our eyes off of that prize, which is coming up in November. And so it's going to be very important. And so because the government has a function that is an ancient function, and it's a function of caring and nurturing in its legitimate form. And what we have seen over many centuries is the legitimate function of government being put into the hands of a market-based economy. And those two things, and most oftentimes, are not compatible when it comes to the caring and well-being of our children and our families. And so we've seen this over and over through history, and we've asked for remedies, and we will continue to do that. I am sure our young brother, Joel, who's going to be coming next, is one of the young lions who we need on the front line. And so this lack of connection to the people and financial gain as a motivating factor for our involvement in the civic arena needs to be examined. And our involvement in the civic arena should be based on the idea of culture, caring, nurturing, service, stewardship. These things need to be taught in our schools, and they need to be held up as examples of right living and right thinking. And so moving forward, we need social structures meant to sustain society, not meant to extract resources from our communities. It's about sustainability. And so moving forward, we need leadership rooted in a test of integrity, education, with an underpinning of nurturing and love. So what does that mean? That means that we need to support pathways to leadership for Indigenous people, people of color, for the voices for women, for the voices that have not been given the time that they need to air their most insightful and beautiful words that may bring about the change that we need. And so let's all look at how we can lead a movement towards lifting all people, not just Black and brown or Native or Asian people, but white folks as well. We're one people. And I think that type of leadership coming from the Black and brown world and from the Indigenous world, the global South, if you will be a boon for all of our people in the world. This is an opportunity. And I see that in crisis, everyone is recognizing the importance of the worker. And so we should, not in crisis, we should be caring for our workers and caring for those families going forward. Now, I just wanted to say we need to be centered in community. This is soul work. Search your soul. If it's not right, we shouldn't be doing that. Kindness and sharing should be the bottom line. I've got a couple things we need to think about, a consciousness shift based on seeking the common good and common ground. This is something that I think will benefit us greatly. Now, when we move forward, I want to think about the demographic change that is existing in our community and the fact that there are people who are resisting this change intentionally. And this is the kind of leadership that we're talking about. Let's not understand that in the COVID-19 and many of the things that are happening in our country are happening intentionally. We had people in the southern border in cages intentionally. And so this is very important that our leadership be questioned and that we make sure that all of our people are on point when it comes to voting and being registered to vote in November and any way we can get there. And I think vote by mail, let's make sure we continue this conversation. And so we have to be present, and we have to be understanding that the federal government does matter and that we need to have integrity in leadership, and we need to question them undyingly and move forward. And I just wanted to say that I really appreciate the fact that Beyond Toxics and all of the supporters of the Pathway Summit have come together to continue to support this work in the midst of this. The NAACP ourselves as a branch has moved immediately into caring for the families that we were working with prior to this, mostly African American, Native American, Latino families through our educational programs. These programs work with the Oregon Department of Education to serve these families, and many of the issues that they face prior to this COVID pandemic are being exacerbated, and we want to continue to serve them, and we'll be here. And I think it's testimony that we're going to continue to need the nonprofit sector to step up, and there need to continue to be support for community-based organizations going forward. And I'm just happy that we're able to be here and operational at this time and to do this work and to keep our eyes on the prize at the NAACP. There are two slides I'd like to show you right quick. Slide one, which is coming out of the National Office of the NAACP. And it is a slide talking about the campaign, We Are Done Dying. What you're looking at right now, this is the We Are Done Dying campaign. If you would go to the NAACP.org, you can sign on to this campaign. We are trying to get in touch with lawmakers and let them know that we're very concerned about the response and that we'd like to put an end to some of these policies that are bringing about negative results in our community. So you can sign on to that and send it to the NAACP. We have a representative in DC at national level at all times, Hillary Shelton. And then if you'd go to the next slide, it's coronavirus equity considerations from the NAACP resources. Now, if you slide through this, you can you'll find that on our NAACP national website as well. There are many news articles and links that you can from throughout the world to look at how the coronavirus is really affecting people of color and some, perhaps solutions and efforts at mitigation that you can tap into. So I would just point you towards those things. And then lastly, we do have a website, local website, the NAACPLaneCounty.org. We're a membership organization. We would appreciate you to, if you would become a member of the organization at this time. It's showing that as community-based organizations, we can come together, we can make impact. We're working here at the NAACP. The office is open. We are serving school lunches to over 50 families per day, Monday through Friday. We are making deliveries to 20 families Monday through Friday, and we're also making care package deliveries to weekends. So far, we've reached out to hundreds of families, and we want to continue that work until times get a little more balanced for them and for our society. So thank you for this time, and I'll be ready to answer any questions later.
Great, thank you so much, Eric. That was really great. Because of the current situation we find ourselves, the current pandemic, it's a little hard to remember how important voting is in getting out and participating in the election process. But we need to make sure that our community voice is heard and that we're actually influencing and holding our government accountable. So we are going to move on to our final speaker, and I'm excited to introduce Joel Iboa. Joel is a coalition manager for CAUSA Oregon, Oregon's immigrant rights organization. Throughout his career, he has led coalitions in defending against anti-immigrant and anti-Muslim policies and ballot measures. He currently serves as the chair of the Eugene Human Rights Commission and is the youngest person to be elected chair for the Oregon Governor's Environmental Justice Task Force. So Joel, go ahead and take it away.
Thanks, Haley. And thanks to my fellow panelists for hopping on today. We're in the midst of a global pandemic, and I know times are kind of strange. They have been kind of strange. But it's really important that us as participants in community-based organizations or health clinics like the one Dr. David Galvez, or academics, it's important that we continue to do our work, and our work right now is more important than ever, right? Before this pandemic, the majority focus of community-based organizations and other folks, whether it be academics or doctors, is to reduce harm. To reduce harm in areas that in the past we know exist for a reason. We know that this harm is systemic. It's been something that's been following us for a long time. And that's, I think, at the basis of a lot of what I want to talk about. I know we have 10 minutes, so there's a few things I want to cover. One, of course, is, you know, how we've gotten to this point, sort of what this point means right now, especially as it pertains to environmental racism and the communities that live in the state of Oregon. And lastly, the importance of a democracy, you know, and the impacts that a good democracy has versus one that an anti-democratic behavior sort of, what the deep impact is on our community. So to begin this, you know, back in March, we knew that the coronavirus was going to hit us here in the state of Oregon, and it did. On March 23rd, our governor had an executive order that that really stopped Oregon in its tracks. Right, a lot of us were forced to remain at home, and immediately afterwards, you know, myself and other folks in the state sort of knew that we needed to move quickly. And, you know, I have roles in the Governor's Environmental Justice Task Force, the Eugene Human Rights Commission, and as coalition manager of CAUSA. And in each level of sort of my role in advocacy, there was a role to play. First of all, the one thing that really deeply has concerned me, and that I know to be true, is that this pandemic, this virus, is impacting Black, Indigenous, and people of color at a disproportionate rate. And the community that I have most been focused on, you know, is the immigrant community, is the Latinx community here in the state of Oregon. And it's, you know, we know that the federal response too has not been adequate. It's been insufficient for BIPOC communities. And when you take a look at immigrants and their families, it's even more so, especially as we know that they have been excluded from receiving economic relief. And for the Latinx community, you know, here in the state of Oregon, 29.1% of the state's confirmed cases have been from what's deemed as Hispanic individuals, right? We're talking 29%, that's almost a third of the state's cases have been Hispanic communities, despite only accounting for 13.3% of the total population. And when you take into consideration the fact that many of our so-called essential workers are facing occupational exposure. We heard from Dr. David Galvez that many of her patients, talked about the horrors of being forced to work really closely together, putting not only themselves at risk, but their families at risk. And it continues to happen, right? These frontline workers, they work in healthcare, agriculture, they work in outdoor labor and factory and warehouse work, groceries, food service. It's a very deep concern that we have. At the same time, it's really important that to remember that again, none of these people received economic relief, especially if it had to do with their legal status, right? But to prevent an even greater tragedy, it's my firm belief and the firm belief of CAUSA and all of our immigrant rights colleagues that the Oregon legislature should provide assistance to laid off workers without legal status. Right? And these immigrants have been essential to Oregon's urban and rural communities, right? These folks are our neighbors, they're our classmates, they're our business owners, they're our family members. We currently have about 86,000 children in the state of Oregon who live with a family member without legal status. So that's about 1 in every 10 children. And the vast majority of these children, almost 83%, are U.S. citizens born and raised in this country. And we know that immigrant workers, right before the global pandemic, provided labor for key industries. And that's even more so true now, right? Agriculture, food services, manufacturing, a lot of these industries have been devastated by the crisis. And, these workers typically before the global pandemic, they've carried out their work for low pay. And now we have a federal government, just the other week, Donald Trump suggested to cut the pay for farm workers. So not only do we have an industry that was already disrespected at a very high level, but there's some historical implications. When the New Deal passed and during the first Great Depression, right in the early 20th century, who was left out of the New Deal? And for the Southern legislators, they would not sign the New Deal unless farm workers and domestic workers were excluded from being able to unionize. And that's because the majority of those workers at the time in the South were Black. And that legacy has stayed with us up until today, right? And the behavior and response by our federal government to farm workers and their essential work was not to increase pay or to provide hazard pay. Their response was to reduce their pay. And that shows you the state of our democracy at a national level. But Oregonians, immigrant Oregonians, they pay taxes just like everyone else does. Income tax, payroll tax, property tax, and all the other taxes that we are all subjected to, right? And even during this time of crisis, even though the federal government knows that these workers are essential, not only are they sort of advocating to reduce their pay, they've been excluded from almost all social safety net supports. And right now we have a skyrocketing layoffs, and many of these folks cannot access unemployment insurance. So back in March, Congress enacted a third federal relief package, but this legislation did not extend unemployment insurance to self-employed individuals or other categories of workers not normally covered by unemployment insurance. But it left out immigrant workers without legal status, right? These immigrant families were completely cut out and cast off assistance by the federal government. And so right now what's happening is we have a lot of immigrant families who have little to nothing to sustain themselves. And it shows the importance of community-based organizations. I think it shows the importance of the role our state government can have on a community, right? Because how can we ask immigrant workers to abide by the stay-at-home order and also call them essential while at the same time denying them any income support to help them pay for food or for other basic necessities. Not only is this cruel, but it undermines the whole goal we have right now of isolation. So for what we did here at CAUSA is we started what's called the Oregon Worker Relief Fund, which would provide workers without legal status a wage replacement. This will help immigrant families take care of themselves and their loved ones during these extremely difficult times. And we have received a small, what we're calling a down payment from the Emergency Board of $10 million. But there are 74,000 workers, estimated workers, without legal status in the state of Oregon. And to be able to provide 1 month of a wage replacement would total over $100 million. So we're just getting started. And it's really important I know the city of Portland is trying to provide probably around $200,000 to pitch into the Oregon Worker Relief Fund, but we need more. And that's especially true as, we have written testimony to the governor around the impact this has on farm workers. We've talked about other agencies, OHA and Oregon OSHA right now should be leaders in protecting every resident in the state of Oregon. And really, environmental justice is about rectifying these historic inequities. And unfortunately, what we're seeing is that these historic inequities, whether it be you work as a frontline worker and are sacrificed to industry or sacrificed to pollution or exposure to chemicals, or whether you live close to a pollution source. And it's very scary because not only are these communities, as I mentioned, not receiving economic relief, but they're also forced to often live nearby really harmful pollution sources. And we know that this disease is a disease of the lungs. So if you already live in a community in which your ability to literally breathe is compromised, then it's no surprise that the disproportionate amount of cases are happening in Black, Indigenous, and people of color communities. And it's right now is an opportunity for us to prioritize these communities and to ensure that they're protected. I think it's the responsibility of community-based organizations, elected officials, and including our federal delegation. Thank you.
Right. Okay, so just a quick reminder to all of the attendees, if you have any questions, please put them in the Q&A box at the bottom of your screen. So thank you all to the panelists for your amazing presentations. This is a timely and much needed conversation that needs to happen not only among our decision makers, but our communities. And I think it's very beneficial to prioritize the voices of underrepresented communities during times of crises. And in order to do that, we need to look at the historical and social structures that have shaped our ability to adapt and cope with climate, environmental, and health stressors. So I have one question, and just to get it started, and then we'll take a couple of questions from the attendees. And I just want to ask you all, how do you think we can center both the goals of the environmental and social justice movements in addressing, current environmental, climate and health stressors that are affecting our communities today, while simultaneously finding ways to empower these communities and find ways to make sure that they know how to voice their concerns and that they can actually influence the solutions that are being put in place, especially in terms of the CARES Act and receiving funding.
And I could talk a little bit about some of that. I mean, I think right now what we're seeing is that, government is supposed to, I think at its core, be helpful to its community. And at the same time, it should recognize when it needs to get out of the way. And right now what we're seeing is that government is not responding fast enough to the need in community. So while it's trying to catch up, our community-based organizations like NAACP, right, like Beyond Toxics, like many of the other social service organizations in our community are trying to step up to the plate, are trying to provide that much needed relief. And I think community itself is, we're seeing sort of examples of mutual aid. I've spoken with folks in community or other organizations that do more direct service work, and what they're telling me, what we're seeing is that communities before the global pandemic were experts on getting what they needed, right? Calling a cousin, an aunt, an uncle, a coworker, you do this and I'll do that. And that's what we're seeing too right now is, yes, we're living in a time where a lot of people are suffering. A lot of folks are in a lot of trouble. But at the same time, we're seeing a lot of mutual aid, and this mutual aid is our patterns of behavior that have existed for generations. Because the world has not provided our communities with abilities to thrive, so we've had to create specific patterns and behaviors in order to survive. And that's no different now. I think we're seeing a continuation of that innovation in our community. But in terms of the second CARES Act, we were able to here at CAUSA get a copy of the new CARES Act that might be considered this Friday in Congress. And we do know that many of our asks were included. We approached our congressional delegation to provide a list of things, including allowing I-10 filers, people without legal status, the ability to receive economic relief, remove the barriers for eligibility for unemployment insurance based on your immigration status, expand the access to COVID-19 testing and treatment regardless of your immigration status, specifically knowing that this is impacting communities of color first and worse, right? Expanding work permits and status for immigrants with employment authorization, increase in language access to community partners, PPE, right? There's a sort of a list of things that we asked our congressional delegation to do. And fortunately for us, Congresswoman Bonamici, U.S. Senator Ron Wyden, Senator Jeff Merkley, Congressman Kurt Schrader, Congressman Blumenauer, and Congressman DeFazio all signed on to this letter and sent it to Speaker Pelosi, sent it to Charles Schumer, and we're really hoping that this Friday this new CARES Act will pass with all these provisions, but we know that it's going to be a tough fight because there's some more conservative members of Congress that are not going to want to for our communities to receive relief. So,
yeah, I think that that does speak to the intentionality of some of the actions that we see by some of our leaders out there. And so we need to be wary of that and make sure that we are acting just with the same intentionality going forward. And so I think that the idea, I saw a question about the communities of color and the prison populations, and that we see that even Oregon, even though we're kind of a backwater state, so to speak, we only have about 4 million people in the whole state of Oregon, whereas the city of Houston has that many. But the idea is that, so the word doesn't get out in Oregon about what's going on as much as you would see in other states. But as Joel was saying, the data shows that the disparities exist here just as they do nationally. So in the prison population, we're talking about a 3% Black population, and yet we're talking 13% prison population. I don't have data right now. Unfortunately, I'm not as strong as that as Joel is. But we do know that there is issues. I've received calls from the local jail about their concerns about their status there. And so the idea that Oregon is such a small state, the population is small, those concerns exist. We just don't hear about them as much. But we hope to make sure that our state delegation up in Portland and other places are paying attention to that.
All right, Pradnya and Eva, did you want to speak to that at all, or else we can move on to the next question? We got a lot of good questions coming in the Q&A. Okay, so I guess, Eric, I think you brought up a really good point, and I would like to see how you can expand upon how mass incarceration is considered an environmental injustice. You know, how does their access to certain resources while they're incarcerated matter? And how can we address those issues?
So it's very similar to the idea of where do people want to put their resources? Are these folks worthy of the resources that we need them to have to be safe in these places? So we know that mass incarceration in the United States has not been working. We feel like if someone goes into prison or something, there should be some kind of rehabilitation that takes place. And there are not the facilities or the resources being put into place to have that type of reality take place. So there's been an issue about mass incarceration and how we are treating these prisoners in the first place. And so when you have a COVID-19, a situation such as this, when inmates are bunked forward to a room and the room is very small, 6 feet across or whatnot, it's an incubator. And so many of the decisions that I see being made are blatantly racist, intentional decisions that how can you have 1 week you say, well, we're finding out that people of color are dying at disproportionate rates all over the place. The next week, everyone's good for let's open it up. So at this point, we really do need to call it what it is. There is a racist response to this COVID-19 that has to do with how folks are putting people's lives, and it just so happens to be as America grows in numbers, it is growing browner and blacker, and perhaps those are not the type of lives that people value, but we need to value all lives. And so at this point, that means that lives over commerce. And so I just think that we need to just stay on point about that and understand that, unfortunately, some of our prison system is privately owned. This is commerce. And so there's a whole long issue about that with the system itself and the public trust and how our federal government operates and how we're going to operate going forward with a little more people-friendly leadership at the very least.
Great, awesome. I mean, thank you. That's a very important point to consider, is asking the question of who is essential and who is non-essential, or who is indispensable. And most of the time it is underrepresented communities. So that kind of brings me to a question I'm hoping all of you can answer, is how can we avoid getting to a point where we have unanticipated trade-offs? You know, we think about sustainable development. So what does sustainable development mean for underrepresented communities? If we have, say, for instance, some type of clean energy, you know, developed in one place, whereas it might not benefit somebody in another place, or they experience environmental degradation on behalf of that step forward to sustainable development. So I guess one way in which I guess I could reframe it is, how can we move away from compromise? How can we move away from developing solutions that are always taking into account economic development and making sure that the economy is still stimulated by investments in fossil fuel infrastructure, and other investments in non-climate, sorry.
Well, I mean, obviously, I think, you know, the whole idea of the Green New Deal, the whole idea of like, we do need to invest in platforms and weight and energy and even structures that are new. We need to have innovation. And I think that that's a lot of what we see, this whole idea of the global South, if you will, are people coming into the United States from the South or from anywhere, has always been a boon because we're bringing in knowledge, we're bringing in passions and skills. And so I think we need to still have that love of multiculturalism, the love of growth, the love of idea that we can innovate and we can bring this to a new space. So I think that looking forward to all the issues that have been brought forward, and the fact that, look, we know even the government reluctantly is acknowledging that our essential workers, so to speak, are essential, and these are the lowest paid people in our economy. Yet we need to support them. So going forward, there needs to be that shift of how are we going to support that base economy with green energy, with green jobs, with even if it's okay, let's start to invest in lower community-based organizations so that they can become economic engines and raise civic participation and do whatnot. So they're going to have to be different ways of looking at this economically. And I think the green idea of green technology and green thought processes is going to be what it's about. Sustainability, slowing down a little bit.
I'll just add real quick. I think it's important to realize, right? I've heard a lot of elected officials, not everyone, but a lot of elected officials talk about that we need to go. We want to come back to normal. We want to get back to how things were. But I don't think I don't think that's going to happen. I think the world that we lived in before is gone. And in some ways, you know, many of us are mourning that. And I think in particular, you know, people who have enormous amounts of wealth are sort of exasperated and desperate for people to get back to work. Because if anything, what this pandemic has shown us is that that these people, these billionaires, are not rich because of the work that they have done. They're rich because of the work that the most vulnerable have done. And the fact that we've all been forced to socially isolate is proof. Right? The price of oil has plummeted. You know, I went to go put gas in my car the other day because I've driven probably 10 miles in the last 2 months. But it was very, very cheap, you know, but right now I think post pandemic, as we get to a stage where we're going to be able to come out again, you know, I know for me, I'm very excited to see the type of action our state, other states make, and hopefully our federal government takes after this, right? That we have an opportunity to transition away from very harmful, polluting energy, you know, to an economy that's based on renewable energy efficiency, that's going to help ensure a diversified energy supply. It's going to provide more jobs and cleaner air for Oregonians, right? Can you imagine had we taken really bold climate action a few years ago? This pandemic probably maybe would have still hit, but its impact on vulnerable populations would not be as severe as it is now. And I think, you know, for us, putting a cap on emissions, you know, it's going to drive industrial innovation, technological development, and also like help us maintain economic competitiveness and growth. I don't think they're mutually exclusive. I think we can have both.
Just adding on to that, there have been reports and news media has been covering how the pollution rate has dropped down and how the emissions rate have substantially increased in past 2 months, which is all good and nice, but I don't think so. Like that's the climate action that we are looking for. We want it to be centered. We don't want people, migrants, and people in global south suffering, and like and the emission rates dropping down. We want a kind of climate action which is centered around social justice. We don't want people to suffer on one hand, and on other hand, like we cheering the that we can see Himalayas in Delhi, or we can see something in LA. So I would also want to highlight that point, that our climate actions and sustainable development should center social justice.
Okay. Well, awesome. Thank you for answering that question. And I just want to move on and make sure we're including Eva in the conversation. And I know you mentioned a little bit about information and having accessibility to that information for communities, non-English speaking communities. So how are communities of color receiving information at the present moment through social media, say, or print? And how can information get put out in the most effective way based on community needs? Eva, you're on mute.
Thank you very much for that question. I think you're absolutely right that our communities are often left out of the mainstream media, and we noticed this early on in early March when we started noticing the media coverage for COVID-19. If you would tune into Spanish radio or Spanish TV, we're noticing that the information really wasn't there. And so I think that we have to understand that many are essential workers, do not get their information in the same way that we do. For all, many of them are Spanish speaking primarily. Many of our recent immigrants from Latin America do not speak Spanish, they speak other indigenous languages. And oftentimes they just don't have access to newspapers and to different websites that most of us would have access to, journals and things like that. So we need to be really creative in getting that information to them. I know that what we've been doing a lot is I'm on the board of directors for Migrant Clinician Network, which is a non-for-profit that provides clinical support to clinicians who are providing care to immigrant communities. And we did a lot of things on Facebook. So webinars via Facebook is definitely a really good way to reach the community. But I think it's just really important to know that I think Eric mentioned this earlier, we need leaders who are really on the front lines, but of the community as well. I think many people, when they see somebody who looks like them and speaks like them, they're much more willing to pay attention. And so I think this just speaks to the fact that we need to develop leaders, especially our youth, to really, people who are coming from these communities, to really learn about these issues so that they can go back into the community and really provide education and information. I think that that's what we're often lacking. And one of the things that I strive for as a physician is being a voice. I have the privilege of being on the front lines, caring for patients. It's like a front seat window to those lives. And I think oftentimes we have these conversations that are so important about solutions, but it doesn't often get into our community. So develop leaders who can straddle both worlds and really bring that information in a way that's easy to understand and is really meaningful for our community. So I really feel strongly that being leaders, like Eric said, is going to be key. Hearing Joel talk and all of the information he has, it's so important, but it means so much more when it's coming from somebody who has lived these experiences. It's so much more credible. So I think that's what I'm advocating for, is being creative, making sure it's in a language that is understandable, that is at the literacy level of our community, but also that the people who are providing that information are coming from the community and really understand the challenges that our community is facing. So thank you for that question. And it's not just in healthcare, right? I mean, yes, we need physicians and we need nurses and we need people in the front lines who are from the community, but also people who are involved in policy, right? We need people in all sectors that understand what the community really needs. And as a physician, it's been humbling for me because I think physicians, and we come from a society that tends to believe that if you have health care and you have access to knowledge that you're going to be healthy. But what we've learned is that's not the truth. What we know is that healthcare and knowledge is only a small piece of the web that makes up a healthy community, and that we really need people from different areas to really work with healthcare providers to make sure that the healthy behaviors that we promote can actually be implemented by our community, that they have a place to live and work that actually supports these healthy practices. So I'm learning a lot with this pandemic, and I hope to continue to just be able to partner with people that are outside of the healthcare field so that we can really bring health equity to the vulnerable communities.
Great, thank you. That was a wonderful answer, something I was definitely looking for. So I want to make sure we also bring Pradnya into the conversation, because there are a lot of similarities in the problems that are affecting frontline communities locally, nationally, and then internationally. So I'm just wondering, what's missing from the conversation, Pradnya, in terms of considering international impacts and what is needed to address pandemics such as COVID-19.
Mm-hmm. So I can speak more about India because that's the most familiar context that I have. So in India, we have had like in the US, we have an authoritarian regime right now, and the lockdown has been really punitive. Like people were given 4-5 hours before the lockdown was announced, and people had no time for preparation. And especially there's so much of eugenics that is underlined towards the lower classes and the laboring classes who usually come to the cities from the rural areas to work, and they have been left stranded, and it was a really difficult situation for them in terms of like they had no means of transportation to go back to their villages, and also the local authorities and the state on the federal level have been really harsh towards these communities. And in terms of right now, like only the main demand that we have from the state is just to provide some direct benefits to the people who are really in no position because their livelihood have been lost, and they have been in middle of like cities walking like for miles together just to reach to their homes. Is just like being able to at least provide food and like some direct cash mechanism which can help them sustain this period. And I don't know, like mostly I don't have much nice things to say about that national government and their response, but I would like speak about the communities, like who have been able to create mutual aid networks, who have been like supporting people who have lost livelihood, having common kitchens where people can come and like at least have food to eat. And it's mostly like people who are trying to just show resilience in this really difficult time. But I would like say the national and the state support has been very, very, very minimal.
Thank you so much. And I really I think every one of you mentioned mutual aid networks and really having, nonprofit community organizations step up to the plate. And I'm getting a couple of questions, and just because of the current situation we find ourselves in where we have to social distance and stay away from each other, do any of you have suggestions on how we can continue to connect with our communities and make sure that they are up to date and continue to keep these strong relationships intact as we're having to deal with the current situation that we are in?
I just want to provide a quick update. Actually, right now at 10 o'clock, I know the governor's having a press conference about the first phase of reopening Oregon. To my understanding, during this first phase, some malls, some restaurants, and some other facilities will be reopened. And I know that at least 15 counties, and definitely more, have applied and been approved to reopen, including down here in Lane County. So I think, and I know that it's going to be, limited to gatherings of 25 people or less. But I'll stop there and just say that I have concerns, knowing that a lot of the guidance that we're providing here in the state is not as stringent as some of the federal guidelines. I'd love to hear from others.
Haley, I think the question was how we could get information to our communities given that we've been asked to socially distance. Is that what you were asking, or?
Yes, and no. I think what I was more of trying to get at is, and also taking into account Joel's answer, how can we continue to build relationships, and how can we make sure that communities or community individuals aren't left behind, or they feel like they're isolated and can no longer participate in these types of movements to advocate for sustainable development, sustainable solutions.
Mm-hmm. Yeah, I guess I don't have a great answer to that. What I was thinking about when you mentioned the social distancing. I was just thinking about one of the things. So I guess to answer when you clarified, I think we just make sure we have representation. So we need our communities to have a direct voice at the table when we're making policy decisions. And so again, somebody who is from the community, who understands the issues and can really have a voice at the table. And so the reason I was asking, because I just think one of the things that is really important that we haven't really touched on is that there is a psychological toll that social distancing has taken on people. And I think often we forget that. And as a frontline physician, I see that a lot. I see people who were already very socially isolated because of their documentation status, or because they are living far away from their families. And so what we're seeing an exacerbation of people who are lonely, isolated, and you add on top of that the fear that you could get sick, and then if you get sick, that means that you're not able to work. There's also a lot of fear that I have heard about being sick and then being blamed for others at work that get sick and can no longer work. And so there's a real big stigma right now in our community about testing positive for COVID. And unfortunately, my concern is that, we have, at least at our clinic in the state, is providing more testing. But my concern is that if we do, that there will be people who will not want to come forward to get tested if there continues to be fear about being isolated from family and friends, and that you won't be able to work and that you won't qualify for these public assistance benefits. So as much as we want to reopen the state and we want people to get tested, we cannot forget that people are still living in fear because of these immigration policies that we have. And so this is why I think it's so important that we need to have a voice from people in our community to say, you know, you can provide us with testing, you can provide us with education, even if this is all free. But if you can't make it so that we feel safe to come forward and get tested, and that you can guarantee that if I get laid off from work, my family was going to be okay, we're going to be missing a lot of people. And that concerns me as a physician, because at the end of the day, I'm taking care of people who are sick. And if we see a surge, it's going to affect me, but then it's going to trickle down to the rest of us, right? To the economy, to the growers, to the factories. And so I just really think that that's something that is not, that we're not paying attention to, but I'm starting to hear this rumbling in the community.
I just want to quickly add to your comments, Dr. Galvez, that, you know, I think when you talked about people who are already isolated, I think that also includes people with disabilities. You know, and sort of when we talk about like real deep data, right? Race, ethnicity, language, disability, those are the communities that are going to be impacted first and worst by COVID and are already isolated. But one of the things that I just wanted to highlight for the people on joining us today is that 1 in 4 Oregonians live with a disability, and 1 in 8 Washingtonians would live with a disability. And these are communities that are already, you know, they're not really considered a population. They're, you know, you kind of hear about folks with disabilities, but they're already people who are underemployed. And the disproportionate level of people with disabilities are Black, Indigenous, are people of color. So not only the social isolation, but also, right, like the threat of being immunocompromised, global pandemic. So even as we begin the phases of reopening, I'm curious, Dr. Galvez, like, how do you feel about these communities that are already immunocompromised, right? How do you feel about the 1 in 4 Oregonians that are already living with disability? And maybe right tomorrow, it's tomorrow, a lot of folks are going to be able to go out again. But what about those people, like you mentioned, who are already isolated and also may live with disability or may be immunocompromised?
Well, it's, you know, it's a real concern, and that's why I think it's a tightrope that we're walking, right? I mean, we're trying to reopen so that the economy can start to move forward, but as you do that, you run the real risk of hurting people who are already either immunocompromised or that are really sick. And I think this is probably one of the toughest questions that any of us here will ever have to answer, is how do we move forward without hurting people? And it really comes down to, I think Eric was saying, we have to have compassion, we have to have love. And if we're thinking just about money, then people are going to want to go forward. But if we're really thinking about a better world and health justice for all, then we need to take a step back and say, we all need to make a small sacrifice for the greater good. And this pandemic has really highlighted that it's really a little bit of sacrifice is for the greater good of all. So I don't have a good answer for you, Joel, but I'm sort of just really right now watching day by day to see what's happening with the numbers as we begin to reopen. And I do fear for those people who have disabilities or already immunocompromised, because I mentioned this again, but I mentioned this before, but I'll mention it to you all again. There are faces behind these numbers. There are faces behind all of this. And I can tell you that the hardest thing as a physician is to stand by a family, watch their loved ones die, and not be able to go into the hospital to say goodbye. And when you experience that as a human being, it really makes you realize that, you know, money and power is nothing compared to watching somebody suffer and die. And so again, thinking about the economy, thinking about policies, but let's not forget that there's people here, and people are scared, and some people are dying. And actually, I'm attending a funeral at one, or not a funeral, a viewing of one of my patients who just died, a 75-year-old Latino male who was uninsured and was afraid to go to the emergency room. And
Yes, I'm so sorry to hear that, Eva.
thank you. And I know that our time's out, but I just wanted to mention that there is really lots of suffering and fear.
Mm-hmm. Yeah, and I mean, I think that wraps it up. You know, we need to recognize that we are dealing with a pretty serious crisis, and it's going to be, you know, it's so uncertain, but I think there's a lot of opportunity to find effective solutions, as long as we are keeping in mind that there are so many intersections between addressing environmental crises, addressing, you know, climate stressors, and addressing public health issues all at once. So I just want to thank you all again, because we're going a little over. So thank you to all the panelists for providing these amazing perspectives on the current health crisis we are experiencing, and how important it is to recognize all these different factors going in and moving forward. Thank you to all the attendees for joining us and providing such great questions. And finally, thank you to all the staff at Beyond Toxics that have helped me put this webinar on and made everything go smoothly. And we will post more resources on our website afterwards and send a follow-up email. So thank you all, and I hope you all have a great rest of your day.
Thank you.
Thank you. Bye-bye.
Thanks, everyone.